And going to be closing out the summit today with Mari Savickis, who's the VP of Public Policy at CHIME. Going to give us an update from Washington. And here's her bio. Let me just go over that real quick. In her position at CHIME, Mari serves as a voice in Washington, D.C. for CISOs, CIOs, and other C-suite executives charged with the purchase and secure deployment of healthcare technology. In her role, she oversees all advocacy and interactions with federal agencies, the White House, and Congress on behalf of CHIME, and leads a wide swath of health IT and digital health policy priorities. Prior to joining CHIME, she served as Assistant Director of Federal Affairs at the AMA, leading their health IT and HIPAA advocacy, and she also firmly served in both CMS and the ONC. Hi, Mari. You've been hanging out all afternoon. Good for you. So I'm going to go ahead and share your PowerPoint. Just give me a second here, and we will wind down here. Is this mine or yours? Wait a minute, hold on. Yep. No, hold on. Sorry, wrong PowerPoint. Got two of them open. Here we go. There we go. Actually, this is the PDF if that works for you. So.
Great. Let's get started here. So, hi, everyone. Nice to see so many people tuning in today. And I know I'm like the last act here, so I'm going to try to roll through these slides quickly, but also let you know that if you want to copy the slides, which have links, just you're going to email me. There's an email at the end of the slide deck, and we'd be happy to send them out to you. So a few things, and I debated whether I should put in a lot more about interoperability, but in the interest of time, I didn't go deeply into that, but I will touch on it. So big things that are getting attention in Washington, D.C. is obviously there's a growing attention to cybersecurity. I think if you're in the space, you know that. It's no longer a niche issue. Policymakers ranging from the White House down to the agencies, the administration, all the way through to Congress are talking about cybersecurity more and more, and it cannot be ignored. The administration is deeply focused on this issue, and we're going to get into several priorities that they have, which are going to have a direct impact to our members and to companies out there. One thing I'll say is that there are going to be cyber mandates. They won't be right out of the gate, but they are coming. AI. I've been on for the entire event today, and I've taken copious notes, a lot of discussion around AI. So same thing here in Washington. It's ubiquitous. It's here, but it's not here, right? It's everywhere, but it's nowhere. It's very exciting. It's a shiny object. You can't have a conversation without AI. Otherwise, it's not complete. But we are behind the 8 ball. So just like privacy, America is also behind the 8 ball when it comes to AI. And we have other counterparts like in Europe and the UK who've moved ahead of us. So we'll touch on that briefly. And that it brings us into privacy. So privacy, it has had all these fits and starts. And lawmakers, they keep holding hearings on it. There was a lot of movement in the end of 2022, and then 2023 hit, and that was, I'd say, putting that to bed was a great year in terms of like not moving anything. So it's been a little bit stale in terms of privacy. It's still being discussed. There's actually a lot of conversation around, well, maybe we should do privacy first before we do AI. So we'll get into that in a little bit. So let's go to the next slide, please. Here. So let's just talk. This is just a cyber policy timeline to just show you out, like, we've come a long way, baby, right? From 2015, when CISA was first signed into law, and that brought us so many different things, like the outcome of 405D. 405D is actually a provision inside of CISA. 2016, right? NIST starts changing up the CSF, which everything is predicated on. FDA starts talking about medical device vulnerabilities actually being a patient safety issue, which was not always the case, as a previous speaker alluded to. Can't forget WannaCry. Probably remember where we all were when we heard about that thing over the weekend. So we had a little bit of a heads up there. And then, we have the health sector cybersecurity task force, which was actually a jumping off point for a lot of the actions that have been taken in our sector from a policy standpoint. I had like hundreds of recommendations. Greg Garcia. If you don't know Greg Garcia, get to know Greg Garcia. He's the head of the health sector, and he came onto the scene in our sector in 2017. And then just moving down the line, 2018 hiccup. Don't worry about the acronyms. We're going to unpack all of these. There's a lot. Then 2019, this one you may not know, Section 889 of the National Defense Reauthorization Act, try saying that 5 times, ban certain technologies from hostile nation states. 2020, cyber criminals double down and they start using the pandemic again for their advantage. 2021, things are turning around here really nicely. Public Law 116-321, it rolls off the tongue. This is where you start to see HHS say, well, it's Congress first saying, hey, HHS, you may now really acknowledge and give credit to the use of best practices, including but not limited to 405D. Everything must be tied to NIST. Then Patch Act, right? A little bit more FDA oversight around medical devices. Great. CERSIA. We'll get into all these acronyms that signed into law. ARPA-H awards $19.5 million cyber grant last year. That's to Dr. Damoth's group. So that's the backdrop, and let's move on to the next slide. This is for your reference. This is the alphabet soup, okay? You're going to hear the term in 2024. Carter briefly touched on this, CPG. This is new in our lexicon of healthcare language. Cyber Performance Goal, CPG. 405D, you probably heard about that. Those are the voluntary cyber best practices. They will be mentioned in CPG, so we'll be discussing that in a moment. HICCUP. I didn't make up the acronym. That's the product within 405D program that outlines the practices, the best practices. There's a lot of acronyms here. I won't go through all of them. HSCC, this is the Cybersecurity Working Group. CERSIA, that is still coming. We're going to get into that in a moment. That's the mandatory cyber reporting, and then the Patch Act. Okay, so we can move on. And then, so what is going on with HHS? HHS is any day now. When I say any day, we're in the mercy of Washington. You have a snow day and you have a hiccup. It's stuck in clearance. It's probably coming very, very soon, hopefully by the end of the month. But I'm going to point you to the 6-page plan here. And at the end, I think Carol may have the link and we can stick it in the chat, hopefully. But if you haven't seen the 6-page plan, you definitely want to take a look at it. This is going to shape the advocacy for this administration for the rest of this year. And then even it will probably have repercussions for the next, maybe even decade. Key takeaways, cyber mandates are going to be initially voluntary, right? So they're going to be voluntary. And we're going to talk about this in a little bit more, but voluntary pieces that are going to turn likely into mandates. There's pieces about wanting to have funding from Congress. They want to have a cyber incentive program. They are looking, though, at things like potentially using what we would call like the biggest lever that they have, which is conditions of participation in Medicare. Meaning if you don't do this, you can get kicked out of Medicare. That's not really the ideal scenario from our perspective, but there will be a glide path, and we're going to get into all those pieces. So again, the details have not yet been released, but the CPGs, moving on to the next slide, are supposed to be coming out any day now, right? It was supposed to be December. Now it's January. It's almost the end of January. Hopefully very soon. We expect about 20. Again, they're going to start off as voluntary. They are likely tied to 405D. And again, there's some discussion of this inside of the 6-page document I referenced. Take a look at this. HHS wants Congress to give them money. Now, if you know the climate in Congress right now, it's not exactly easy to come by funding. We're still in a continuing resolution. We are on the edges of our seat, waiting, watching, advocating to see what they come up with. But I don't expect there to be some big tranche of money. A few people mentioned the New York funding bucket of money, and based upon our understanding, that's actually existing funding. So we're going to be talking more to our New York colleagues, but it'd be interesting to see how that plays out once those rules end up getting finalized. They're still out for comment. And then again, if you haven't seen the HHS Hospital Cybersecurity Landscape document, that is also worth taking a look at. That is the precursor to this concept paper that HHS put out there. It was released in spring of 2023, and there's a lot of data in here. And that was the jumping off point for HHS trying to figure out how are we going to bring more cyber maturity to our sector. The White House has pressured the administration deeply to move this ball forward. So more on the CPGs to follow. Let's move on to the next slide. Okay, so in that 6-page plan that HHS put out in December, there is a mention of the security role. Oh, I got lots of links for you, lots of them. and in my email at the end. So we will be friends by the end of this. The security rule, everybody knows reopening HIPAA is no small feat. This is coming. So when we say September 24th, it's not like a hard and fast date. It's the aspirational date of the federal government. We're aiming for that time frame. So look for that. Maybe put a soft calendar hold on your calendar right now. Just say, oh, look for HIPAA security rule. It's probably going to be delayed, but here's the thing: is it may not be, because as we approach the end of the administration, the current administration tries to like rapid fire send out all the regulations that they have queued up. So we will be waiting for this, and I would expect that they would try to actually get it out this year. And so you can see here that the reason they are defending their decision to reopen it is basically because it's outdated. Said another way, they're looking at media reports. And there's a lot of that's been discussed in the previous speakers. I just saw an article today about providers being sued over images, personal images being released under ransom conditions, and sometimes even ransoming individual patients. This is going to get worse before it gets better. Let's go to the next slide, please. Okay, CERCIA. Add this one to your lexicon as well. CERCIA was signed into law in March 2022. These are cyber mandates. It is not specific to a single sector, though we have asked CISA to consider making it sector specific when they implement it, right? So first the law is like this broad concept, and then the agency has to get their fingers on it, and they have to start really teasing out and decide how to operationalize this. And we're very different from the energy sector, the retail sector, the banking sector. We already have HIPAA. We asked, hey guys, why don't you think about not, reinventing the wheel, not making us have to report on things that we already have to report on. So what was the question here about the email? Oh, sure. I'll just tell you right now. You can email policy at CHIME Central, policy@chimecentral.org, and we'll get them to you. So CERCIA is another thing that's coming. And what's notable about CERCIA is, I should have bolded this, reporting your substantial cyber attacks. So substantial will have to be fleshed out in the final rule, because they didn't define that in statute, within 72 hours, 24 hours if you have a ransomware attack, right? You can see that the Congress and the administration are bearing down on this. They're trying to close some of these holes. They're trying to improve the posture overall. A lot of this was rooted in the Colonial Pipeline attack, and obviously hospitals, they need electricity, they need water. You can't function without that. We're all interconnected. There was a big aha moment. And the SEC, I didn't mention that in here, but the SEC has mandates for publicly traded companies. While not specific to healthcare, if you're publicly traded, that also is something you have to pay attention to. And there now are going to be state approaches, right? We mentioned New York. So, all right, let's move on to, did I get everything? Oh, maybe, actually, can we just go back to the bottom? So this rule, you can put this one softly in your calendar for March. Soft calendar for March. Don't worry, if you get our bulletin, which we'll talk about, we'll give you the heads up on everything. And we continue, by the way, just to focus on the smaller and lesser resource providers. That is part of every conversation we have with lawmakers here, policymakers. Okay, next slide, please. Okay, so catastrophic cyber insurance. This is something we've been asking for so long. And I mean, the good news is that we've heard there's been a little bit of a normalization in the marketplace after some really, really tough years. I'm not saying that they're amazing based upon what we hear from the CISOs, but it does seem to have like equalized a little bit at the end of, I'd say, like the last 6 months of 2023. So we're hearing from members who say, like, I need 2 policies. I can't even afford the first policy. I'm no longer insurable. These are all things we've heard. So this has also been heard by Congress, and they are aware of that the costs have gone through the roof, and that there's a lot of like skating to the puck. Like a cyber insurer might hear like, oh, this just happened to a hospital. We need to like make sure that this, that you have to meet this when you sign our policy. That stuff has got to end. Otherwise, we're just going to like be in a variety of different directions. And hopefully, when those CPGs, cyber performance goals, come out, perhaps this will put some pressure on the cyber carriers to actually start, I guess, like swimming in the same direction. What else can I say about this? we recently participated in a U.S. Treasury Department, and Vic was actually, who was on earlier, went and sat in for us. So they did some stakeholder engagement. We gave them our thoughts in person. So let's move on to the next slide, please. And thanks, Vic, for that. All right, Senate Bipartisan Cybersecurity Working Group. So yes, Congress is looking at this. I will say we got pretty excited, and it was, I think, December of 2022 when Senator Warner, he is the chairman of the Senate Intelligence Committee, put out basically what was like a manifesto and said, like, I'm going to do something about cyber. And then we thought, oh my gosh, something big's happening, and then didn't happen. And, sometimes Washington moves a lot slower than we like to move. But now we have the Senate Bipartisan Cybersecurity Working Group, which is comprised of 4 senators, Senator Cassidy, Warner, Cornyn, and Hassan. And they're just starting to get started. We have met with them. They are focused on the jurisdiction of the Senate Help Committee, which is where this is really born. So we expect this will probably focus on workforce. And we have pointed them to, again, the Health Sector Coordinating Council. If you're not familiar with that group, I'll talk about that at the end, but they have a variety of recommendations that we helped inform about, like how the government can help out. So we're waiting, and I know they're still meeting with stakeholder groups. So more on that to follow. Next slide, please. Okay. The amazing team that sits behind me, that would be Cassie, Chelsea, and Rafe. Cassie led this briefing on November 7th, and I was the moderator, and we had Eric Decker, who's with Intermountain, Nate Kuchar, and Nate Lesser. I call them the Nates. They're probably not sure if they appreciate that, but they're all 3 of them amazing. And we have a great write-up. It's really short too, and powerful takeaway. Cybersecurity, patient safety. By now, I think that just is a standard refrain. I love this one from Eric. If you have to beat one of us, you have to beat all of us. That's the mindset that we're trying to adopt. We need more support. We're talking to Hill staffers, people who have influence. Hey guys, we need some help here. We know it's a shared responsibility, but we can't do it by ourselves. We need some help here. Funding is a really big deal. And again, going back to that HHS December 6th document, it talked about, we've heard you, stakeholders, that's us and others like you. We've heard you. We've heard that you need funding. However, Congress really does need to be the one who writes the checks. Money just doesn't usually materialize by itself. So that's going to be something we're going to have to continue to work on. So if any of you are interacting with lawmakers, please continue to urge support for especially the most under-resourced and smallest providers, because they are the ones who are the sieve here. They're the ones that have the biggest holes. Other key takeaways were Nate Kuchar had talked about his experience. He's been very public about it from the University of Vermont, lessons learned, right? You got to break down internal silos. You need to focus on patient safety. You have to have an adversarial mindset. So we heard a lot today about you have to be on offense and you have to be on defense. So we have a recording. It's great. It's like an hour, easy listening, and then a summary, which is like 2 pages. So links on that in here. Let's move on to the next slide. Oh, I see another question here. Let's see. What do we have? Okay, I think that was answered. All right. So I just put this in here again. I know you can't see it on the screen, but if you scroll down a little bit more, this is from McKinsey, and it talks about cyber and AI. So organizations should proceed with caution. We heard all of that today. So this is just backing up what we already heard in a nice little graph that you can steal with, as long as you reference McKinsey. So moving on to that, you see lots of problems there. I could have probably, honestly, let me just stop here and say, I could have probably put together like 100 slides on cyber. So if I'm missing something, maybe I didn't think about it, but there's also so many things that we could cover. This is just like a smattering of things I pulled out. CISA roadmap for AI. I pulled this out. I thought this was cool. This is the Spotify Associate General Counsel. She had like a nice little recap here and on LinkedIn. And so go check out the CISA roadmap. It's not sector specific, right? But it's about, it's AI. It's not too long. Moving on. I won't read this for you, just for you to pull apart and take a look at later. NIST AI report. I think that came up. So this is so interesting. So AI, where it's like, again, rolls off the tongue, every conversation, AI this, AI that. What I'll say is it was interesting. I forget who the speaker was today who said they are starting to see some AI field cyber attacks. I haven't heard that from our members yet. Doesn't mean that maybe this is the year we get lucky for that one. But it's probably on the horizon. And what I've been told is at the moment, the cyber criminals believe that it's more cost effective to launch their attacks using AI will be the day that this starts to become like really widespread. So these are the classifications that NIST said, like look for, 4 different types of attacks, like evasion, poisoning, super terrifying to think about poisoning, privacy, and abuse attacks. So poisoning data, I mean, these are all the reasons why governance is so important and guardrails are important. Okay, moving on to the next. What is your email address? I'll give that to you, Stephen. It is at the very end. You're going to have to wait. Haha. All right, GAO report, medical devices. Happy to know that, again, our amazing members were called by GAO and asked for their opinion. We appreciate that. Thank you, GAO. And again, this report, Congress asked GAO, they're like, if you don't know who they are, Government Accountability Office, they're the audit arm of the federal government. So they're under the administration. Congress says, listen, I want you to do a report on this and come back to us. That's what they did. Medical devices. So the long story short, or the upshot is that he's still vulnerable, still a problem, not really seeing major like patient safety attacks being launched. However, definitely an issue to keep on the horizon. Report is right here, nice little infographic. We can go to the next slide. And hopefully Patch Act will start to help tighten those things up. Okay, privacy. I could have probably put in like 100 slides about privacy, but I'm just going to keep it short and to the point. Again, recap. Congress does not have a national privacy law. Everyone knows that, right? States are jumping in because they're filling in where the federal government has not acted. There's some conversation in Congress about should we do privacy before we do AI? A lot of big thinking on AI in Congress, but I wouldn't expect a bill coming out or a law coming out this year. I think that's not going to happen. OCR and FTC. So civil rights, they regulate HIPAA. FTC regulates the consumers or non-HIPAA covered entities and helps protect consumers. So they teamed up. It's like a match made in heaven for government agencies. And they sent a letter to 130 of our closest friends, most of them providers, saying, you're on notice. Do not do this. We believe that you need to be very, very careful with your use of tracking pixels. So pretty much cease and desist. And OCR has, now moved to naming and shaming, putting the names of those recipients on their website. FTC has been clamping down, and they have a whole series. If you're not signed up for FTC, I didn't put that in my slides, but like well worth to get the FTC notices when they come out, because you will find out very quickly who is in their crosshairs. It's pretty interesting watching that happen because they have been very, very active. And then also I think this may have come up, the American Hospital Association, who we work closely with, they are suing HHS over the December 22 guidance, which again is, there's 18 points of protected health information. They're going in, honing in on the HTTP piece, and they pretty much made up their rules that didn't exist until December 2022. And the AHA was not very happy. And frankly, we weren't terribly thrilled either. So it's made for a very confusing landscape. And so our members are trying to figure out ways to make sure that the data seepage is not leaving their environment, but it has, that's a whole other conversation, but it has mixed in with the cyber conversation, and it is quite challenging. So the metapixel thing will be a thing from here on forward, moving forward. Okay, so I know I'm getting to time here. So if there's nothing you do today, you could spend maybe 5 minutes. You could click open the December 6 paper. You could glance at it. You could print the 405D hiccup. Those are the best practices. There's one for smaller providers and one for larger providers. You could join the Health Sector Coordinating Council. That's Greg Garcia's group. You could join the group for free. Amazing. Many people I imagine on here are members. And all you have to do is go to the contact button. Okay. Sign up for our public policy listserv. That's the email, Policy CHIME Central. It's free, open anyone, and we will give you the hot takes of the week on Monday. And then if you want to go to LinkedIn and follow people, I'd follow 405D, right? That's an HHS handle. CISA, that's part of Homeland Security, and Greg Garcia, who again is the head of the Health Sector Coordinating Council's Cybersecurity Working Group. Quite a mouthful. I will end here, and I don't know, Carol. I mean, if people, I guess, want to put questions into the chat. So I'll put, I don't know if I can get this to everyone, hosts and panelists,
Yeah, I'm
to
going to
everyone.
go ahead and throw those links into the chat right now.
Okay, because I can't get to everyone, but or I can send it to you. Here's my email. You just email me, and
Oh, it didn't copy the links, but it'll be in the slide
yeah,
deck.
it'll be in
So
the. Here's my, so you can send my email out, and it's at the last slide.
yeah,
Um, yeah. So I don't know. I mean, let's see. What's in here? Oh, there we go. You put it in there.
yeah.
Who was the
The
last
link
person you
the
said
links
to
didn't come through
follow?
though, but I'll make sure it's in the email that goes
I
out with the
believe it was,
recording.
I think it was Greg Garcia. So Greg Garcia, again, going to LinkedIn, Greg heads up. So health sector. Let me just send you this one too. So if you're not familiar with the health sector, this is really, again, this is, think of, there's 16 critical infrastructures, right? 16, you got banking, you've got retail, all the things that make up our society. And then we have healthcare. So with the healthcare one, Greg oversees he oversees the cybersecurity working group, which is a big effort underneath our sector. And it's a joint effort. We work with the federal government and then we as the industry, and we're made up of, I don't want to get too far into the details here, but it's across the entire healthcare sector. It's not just providers. So anything from ambulances to blood to payers to medical device manufacturers, it's everyone. And we all work together to try and improve the posture of our sector. So I don't know, Carol, I think I'm probably at time here.
You are at time, but you did a
Okay.
great job. Ari, thank you so much. Thank you so much. Got some just some very last slides at the end here. So let me just oh, hold on 1 second. Sorry. Oops. Oh, my screen seems to be frozen. So Bobby knows that we are all out of time. So hold on 1 second. Ah, Mari, can you still hear me?
Yes, I'm here. So
Okay, great. Sorry.
yeah. Do you need something?
Let me just got stuck there a little bit. I think it said, "Oh, you've been on too long," basically. So, all right. So that is our great update. We want to thank you and the attendees for sticking with us for our event, and of course, we want to thank our sponsors, Zscaler Scenario and Assimile, for their support. As we've mentioned a couple of times, if you're planning on attending Vive in LA next month, this is a discount code you can use from DHI that'll save you $150. Again, I want to thank everybody for today and your time, and appreciate the 4 hours you spent with us. So have a good day.